Welcome, friends and warriors, to another episode of Power Over Pink. I am your host and survivor, Tara Cam. Tonight, I'm excited to bring to you a beautiful warrior that I met in Atlanta at the Young Survivor Coalition, Joslyn. Thank you so much for being here tonight. Welcome to the channel.
Thank you for having me.
Yes. What you don't know is behind the scenes, she and I just really had a heck of a time getting technology to work, and we're both still smiling. So we know that she's got a good story to tell. As you know, Jocelyn, we see the value in sharing our stories because when we do, it gives us a voice to be heard, and then it helps others kind of navigate their own breast cancer journey. So thank you for being willing to be on the channel and share your story.
Absolutely.
Well, let's jump into it. So tell me a little bit about you, what makes you you, and where you're from.
I am from upstate New York, so it's called Wine and Skill. It's outside of Albany, which is the capital. I was born and raised here my whole life for 40 something years. And, I have a blended family. My parents have been divorced for over 40 years and have been remarried to their spouses. So I have two stepsisters and a half brother, and my mom and her husband have three dogs, and my dad and his wife have two dogs. And so my sister has I have three nephews. My sister has three kids. So yeah, we're just like a big crazy bunch of,
New York?
Irish. Yeah, upstate New Yorkers. People always say to me, "Oh, you're from New York." The first conference I ever went to, they said, "Oh, you're from New York." And I said, "Well, I'm from upstate. I'm not from like the city."
Yeah,
So that's like a very, I guess I talk with an accent.
you
And
do.
so people would say, say coffee talk. And I don't know why, because I say coffee fine, but people always say, "Oh, you have an accent." I was like, "No, I don't."
I mean, it's slight. It's not very thick. I've actually driven through upstate New York. It's beautiful.
Yeah.
Very, very pretty area. Well, so tell me a little bit about your journey with breast cancer. How old were you when you got diagnosed? And tell me.
So I was 36 years old. I was a month shy away from turning 37. I was originally diagnosed in July, but my journey started in May, so like Memorial Day weekend.
Mhm.
I have worked usually full-time and part-time my whole life. So was coming home from a part-time retail position that I had, and there was a letter in the mail that was from my doctor's office that said, "You need to have a bilateral breast MRI." And I really wasn't sure what that was. It was a Thursday night.
Mhm.
The doctor's office was closed on Fridays, and Monday was Memorial Day. So I had 4 days to sit in and, digest that letter. And I kept saying to my family, like, "Why do I have this? Why isn't anyone calling me?" And by Tuesday morning, the doctor's office called me and said, "You need to see a breast surgeon." And I was like, "Wait a second. I have this letter that says I need a bilateral breast MRI. Now you're telling me I need to see a breast surgeon, or I need to see a surgeon." So I had asked if I could see my family surgeon, a guy my dad went to high school with. He had taken out my gallbladder. He'd done surgery on my stepmother. He had done surgery on my brother. So, I said, "Why can't I just go see my family surgeon?" So my mom and I went, and my boyfriend at the time. So the three of us went to see him. He was awesome.
Mhm.
And he threw up the imaging, and he just said, like, it just looks like someone took confetti and just threw it up in the air, and it was like all trickling down. And he said, "I really need you to see a breast surgeon, Jocelyn." And I thought, "Oh, all right, like, I don't know. Like, I don't know what this means." Most of the people that I've known my whole life, and I'm not a stranger to cancer. I've been volunteering we have an organization here. It was called Gilda's Club, but it was started by Gilda Radner, and they're all over the country. And in New York City, they have a thing called Hope House where, cancer patients stay. About 10 years ago, Gilda's Club merged with American Cancer Society here, and it became known as Hope Club. So I've been a volunteer. I've done Making Strides for years. So I have not been a stranger to cancer. So, then started the process of trying to find a breast surgeon, getting an appointment, which takes a couple of weeks. And I saw a woman who then sent me for a breast biopsy. So my boyfriend took me, and that was on July 3rd. And what I thought was going to be one biopsy turned into two biopsies. And if anyone knows, you are scheduled for one. And when the radiation or the radiologist comes out, and she was like, "We're going to do two. And you need to get your purse, go to the bathroom, and tell your family you'll be back." I mean, it was like very rushed and like I was just like, "Oh my God, give me my purse." Like, it was just craziness. And so, my boyfriend is an executive chef. So he was like, coming off a 12 or 13-hour day, and he was exhausted and sleeping in the waiting room. And, I had the first one, wasn't bad. They put the clips in. I had a nurse, walk me through, the whole thing, and it was uncomfortable, but it wasn't bad. The stereotactic biopsy, I would say, is bad. It was
Yeah.
bad. And, I'm a person that asks a lot of questions, that wants a lot of information. And when I went for the stereotactic, which was a few hours later, so we were there for like a half a day, the nurse said to me, the radiologist wants you to shut up. She wants you to stop asking questions so she can get through this.
What?
Yeah. So I was just like, okay. So it was
That is
very hard.
terrible.
It was very hard for me to, like, your boobs are in this machine, you're
Yeah.
looking one way, your body's going another way. It's just kind of crazy.
Barbaric.
And my dad showed up in between because he doesn't do well in crisis ever. So he just likes to drop in on anything that's going on. So he was wandering around the hospital aimlessly trying to find us. So he did. And then he bought us breakfast at the cafeteria while we were waiting. And then I sent him home. And I was fine the entire time. They give you like the ice inserts for your bra, and I was fine until we went to leave, and the sliding doors of the hospital opened and we went out. And as soon as I hit the parking lot, I started hyperventilating and crying.
Hmm.
And I'm not sure. I think it was just like overcoming like all this emotion that had happened like since 7 o'clock in the morning, and now it's like noontime. I'm not really sure, but I literally was just like, we never got a day off together, usually in the summer, and we were supposed to go to the movies and we were supposed to have like this great day after. And I just thought, oh my God, like, I don't even want to do anything.
Right.
It was crazy. So I went to, I went back to work, and people were like, oh, 7 to 10 days, like no news is good news. I hate that phrase, by the
I
way.
do too. It's a bunch of BS.
I also am probably the only cancer survivor you will ever meet that does not like pink. I don't love it. I don't love it. I gotta be honest. I don't love it. I have a few things
Yeah.
pink, but I don't love it. And I don't know why. I mean, I've never liked pink like in my whole life, probably
Mhm.
because I'm Irish and I have like pink undertones. So pink never looked good on me, but I am like very,
Can I be honest with you? I don't like it either. In my day to day, I wear earth tones and calm colors, and I really, really, really grew to hate the pink ribbon and everything it stood for, and the whole process. And so I really do hate pink as well. I do have this pink, very pink
and it's
studio.
beautiful.
Thank
It's
you, but it
beautiful.
was more for ambiance and something pretty to look at when I had people in the studio. But I'm right there with you. I think that's a normal thing because it represents what we faced. It represents the hell that we went through. So yeah, hate pink. Power over that pink.
Yes.
Hence the name. Power over
Yes.
pink.
I got that. So I basically found out I had cancer by accident.
Tell me how.
So it was a hot July afternoon, and it was. And I got a call from a doctor's office, which was not the breast surgeon who had ordered the biopsy. It was one of our local oncology offices here,
Hmm.
and they left a voicemail. And I remember like going outside to check my voicemail because, I was in the office and I had an intern and all this, it was crazy. It was a very busy time at work. And I got like a voicemail from this office that was like, hi, your doctor referred you to us. Can you call us back? So before I called them back, I called the surgeon's office and I
Hmm.
said, oh, my appointment is tomorrow. Like, but this other office is calling me, and can I talk to, like, I wanted to talk to a nurse. I wanted to talk to the surgeon. I wanted to, like, and that was before, like, we really had portals
Yeah.
like we do today, where, like, everything is immediately in, like, a portal. I
Yeah.
mean, they had them, but I don't even think to the extent that they're used today. And everyone at the surgeon's office was like, no, she's unavailable. We'll see you tomorrow. I mean, it was like, even now talking about it, like, gets my stomach, like, knots.
Yeah.
Because I
That's
thought, oh my
unacceptable.
God, why is this other office calling and who are these people? I didn't even know.
You didn't know anything
And
yet.
yeah, and it was like nerve wracking. And I remember the next day we drove separate cars because he was going to work and then I was going to work. And, I'm all dressed for the office. I'll never forget it. I had a blue and white polka dot dress on with a white sweater. And he had like a blue t-shirt on and he has blue eyes and it looked beautiful on him. And it was July, so he had shorts on. I had, I'm going to the office and she walked in and she said to me, I have good news and I have bad news. And I was like, okay, which one are you going to give me first? And she said, well, the good news is you have breast cancer. The bad news is I have to remove your left breast. And I
Oh
looked
my
at
gosh.
her and I said, what part of any of that is good news? And so he started sweating through his shirt. And by the time we left there, he was soaking wet with sweat. And I just was in shock. And she said to me, do you want some water? And I was like, and so she said, go out and they'll schedule you for, and it was like after I heard that, like I didn't hear anything else after that. And so I remember standing there, like checking out, and they're like, oh, we're going to make this appointment and that appointment, blah, blah, blah. And it was just like, real, nope. I was like, my ears were shut off.
Yeah.
And so we went out to the parking lot and we both just sat in my car and we were crying. And I just remember like, oh my God, how am I going to go to work? And now I got to tell my parents and he's got to tell his family and he's got to go to work today. And like, it was awful. And so we literally cried. Like we knew we'd see each other later. And then we both got in our cars and we went to work and I got to work. And I remember my dad had an appointment or something, so I couldn't reach him. I called him first, and he was either not home from work yet or he was somewhere and I can't remember where. And then I remember going through, I mean, it's like crazy the things you remember. I was going through the bank drive-through with a deposit and I was talking to my mom and I said, I have breast cancer. And she was like, what? I was like, yeah. And she was like, what? And my aunt was visiting from Wisconsin. And I remember stopping at my mom's house that night after work and she was there and she was just like, what? Like, what is happening? I said, I don't even know. Like, there's so many things going on. People are calling, people want a piece of you at every turn. And so then I think started like the journey of, I worked for a company who was based in Connecticut. And so we had an office here, which I worked out of. And my whole summer was packed with like events, and there was no one else to do the work. There was no one else in that office but me. And I said to my friend who basically went through cancer a year before me, she said to me, you need a new breast surgeon. That's the first thing we're going to do is we're going to find you a new breast surgeon. And she did. She got me into the woman she was seeing who was the best in our area at the time. And that woman has since retired. But if you were a patient of hers, you rose to the top. And my friend called in every favor to get me an appointment with her. And her office, was lovely. And they said, why haven't you been here sooner? And it's like, I've been trying, but I couldn't get in and no one would talk to me and no one, it's like transfer of records and,
Right.
it's like, it's a journey.
Mhm.
So then, I wanted a second opinion. So my mom and I went to New York City to Memorial Sloan. And I've never been to New York City by myself. Every year I go with my uncle. It's a tradition. We go at Christmas time. And I've been going since I was 16. And I said to my uncle, like, I don't know when you get out of the train station, like, which way do I go? And it was like, great, when I had Surrey and an iPhone. And he was like, just take a cab and then get out and start walking and just ask her for walking directions. And that's what we did. And I went into Memorial Sloan. I had my huge accordion folder with all of the medical records and all of the images and everything. And the doctor there basically agreed with the doctors here. And I said, well, at least, I mean, that is like the top notch, cancer institute. I said, at least he agrees with her. And then, people said to me, well, how come you're not having surgery? And how come you're not doing this? And how come you're not doing that? And I said, well, because the doctor said that I've probably had it for a year. And I didn't get a mammogram for whatever reason the year before.
Mhm.
So that's like my PSA to everyone because I had been getting mammograms since I was 30 because
Right.
I had like hormonal cysts. We had family history. For some reason, I don't know. I just skipped it. I was too busy. I don't know why that year I didn't go. And the doctor said, you've probably had it for at least a year. So it's not going anywhere. It's not aggressive. So you can wait. Basically 3 months to the day I was diagnosed on July 9th. 3 months later on September 9th, I had a double mastectomy with reconstruction. And people again said to me, "Oh, how come you're chopping off both arms if only one doesn't work? Or how come you're doing this and how come you're doing that?" And it's like, because I don't want to have to go through this again.
Right.
But in the meantime, I had been tested for genetic, went through genetic testing. And at every turn, I mean, I love the breast surgeon, and she said, "Oh no, it doesn't run in your family. Oh no, this, oh no, that." And I said to her, at every turn, people have said one thing to me, and it's been the complete opposite.
Yep.
And I said, I'm not going to actually believe anything until I see it for myself. And, like, you don't have to be a medical doctor to follow a family tree and like who has what. And I had cancer on both sides. My dad's two sisters had cancer. One of them had it twice.
Mm,
My mom's half sister had breast cancer. So, like, my grandma had colon cancer. My dad's mother had cancer all throughout her whole entire body at the end. So, we were not, cancer was not foreign to our family. We
right.
were very familiar with it. And I said, I'm just going to wait until the testing comes back. And for sure, I am BRCA2 positive, which the doctor says is the lesser of the two evils, but also, it made the course of treatment that they decided to take more aggressive.
Yeah.
I have to get checked more often than normal cancer survivors, I would say, if normal is even like a word to use. And so, I was out of work, and then I had 4 months of chemo. The first 2 months were dose dense, so was like basically getting double of what a normal person would get. And, my oncologist at the time was like, "Oh, you might not get all the side effects. You might not get them." I said to her, "No offense, but on this whole journey since May,
Been wrong every step.
every single person has said to me, no, it'll be this," and it was that. I said, "So forgive me for not believing you." And I didn't. And my mom went to every single chemo with me, every single chemo. And it was, she would pack a bagel for us, and, she'd pack her magazines. And, some of those people that I sat in that infusion room are not with us today. And it's sad. There's some people that I've met at YSC in the last 10 years that are not with us, and that makes me sad. So it's like any time that I can talk to and share things, I do it because I want to be a resource for people who are going through it, who, like me, I went to a support group after my surgery, and I found out from a woman sitting next to me about fertility preservation.
Hmm.
I would have never known,
Yeah.
would have never ever known. No one mentions it to you, no one talks to you about it. Again, the doctors are like, "Oh, well, we're going to do this and we're going to do that and blah blah blah." And I said, "I'm not doing anything until like somebody like does some fertility on me." So literally I said to the oncologist, like, find me a place. There's two clinics here locally. One is called Boston IVF. The other one is called CNY Fertility. No one from Boston IVF would call me back. So I called CNY desperate.
Yeah.
And I said, I need to start chemo soon, but I want to see if I can, like, if somebody can talk to me. Yes, I was in within a week, and my mom and I went, and they said to us, here's all the drugs. They gave us boxes and boxes of like needles. And I just remember them giving us all the stuff to take home with us. And, I met with a wonderful doctor, and they said, this is what you're going to do. And we work with Live Strong, and Live Strong is going to pay for all of this so you don't have to, or your insurance doesn't. So the only thing I had to pay for was like blood work that I had to have done. And they did like an egg retrieval, and then we had the embryos fertilized, and they've been frozen. And I'm hoping in this July, I found a woman to carry a baby. So I
Wow.
am cautiously optimistic. This is my third time. So I'm hoping that, you know,
Yeah.
one of them becomes a tiny human that I can bring home here.
That's
But it just,
exciting.
it's just, I would have never found out any of that information without sitting next to that woman at the support group who just said, "Oh, well, I just had it done like 2 weeks ago and you should do it." And It's like they don't tell you those things.
I don't even think of it.
I think the oncologists just, they're focused on getting you better, which is their job. I understand that. But then they also, they don't think of like the little things. It's like I had very long hair. When I knew that I was going to lose my hair, I was like, you know what? I'm going to get a wig. I'm going to get my hair cut. The haircut's going to match the wig. And it did. It was about the same length as my hair is today, actually. And my hair guy, he styled it. It looked like my hair. So then that way, when I didn't have any hair and I went back to work, no one would know because it looked like my hair.
Yeah,
And, I
that's
just,
actually really good advice.
yeah, I mean, it's like I got my hair cut and people at work were like, "Oh, you got your hair cut." So that was like the first thing.
Hmm.
And then like, I started chemo in November and after the second week, I knew I couldn't work through it. I literally was sitting at my desk one day and was falling asleep. And I didn't know how I was going to drive home from work. And then I told my work I needed to take a leave of absence, at least to get through the AC part of chemo because it was literally killing me. And, I took a leave of absence, so then I didn't really need to wear the wig. I think I wore it a few times out, but it was winter, so I wore hats and scarves and headbands. And, I had my uncle cut my hair into like a pixie cut, and it hurt so bad. Like your hair follicles, they just hurt so bad. And I knew it was like coming because it hurt so bad. And like, I don't know, he cut my hair on a Saturday. I think on a Thursday after another support group meeting, I called him and I said, "Yeah, like I just need you to like just shave it." And he had just gotten home from work and he's a hairstylist. He's been a hairstylist for 40, 50 years. And he said, "All right, I'll run back over to the shop. I'll meet you there, 20 minutes." And my boyfriend was coming home from work and I said, "I'm going there. Can you meet me there?" He said, "I'll be there in half an hour." And my uncle put me in the sink and was washing my head. And I thought to myself, what are you doing that for if you're just going to shave it off? And he said, "Well, you still need like a clean scalp and you still need to like take care of it." And I hadn't been really doing that because I knew it was going to fall out anyway. So I really wasn't like shampooing my scalp because I knew the hair was going to fall out. And so I remember sitting in the chair and he had like, three stations, but a wall of like mirrors. And he got the buzzers out. And all I think of was like that movie G.I. Jane. And he, did like a little, I don't know if it's half inch, I'm not sure. And I looked at myself in the mirror and I just said, I was like, all right. I teared up and I was like, I don't look bad bald. And I said, but can you go like any shorter? Because there was still like a, half inch or inch left. And he goes, if I go any lower, he said, you're going to be bald. And I said, okay. And he did. And I cried.
Mm-hmm.
And I said, I'm going to be okay.
Mm-hmm.
It's only hair.
Yeah.
And like we left and I went home and I thought, okay, like here we go. And my dad, he wanted to shave his head so bad in solidarity. God bless him. And I said, please don't. Like only one of us in this family should be bald and it is me right now. Like you still have good hair. Like don't shave it off. And so, I've learned over the years to just kind of take things as they come because nothing on my journey went the way they said it was going to. Nothing.
No, nothing at all. I have a couple thoughts. I guess if you could do anything differently about the way you were diagnosed, what would you suggest for the medical community?
Well, I feel like that's only like part one. There's like a part two I can share. I mean, I don't know. Honestly, I feel like kind of like tonight in our technical difficulties, like things happen for a reason. And I was raised Catholic, I believe in God. And I believe, that you're set on this course for a reason or for something. And, I tell people, my parents recently both were diagnosed with cancer.
Oh.
So my mom finished radiation for lung cancer in February. And my dad on Thursday will finish radiation for prostate cancer. So he's been going since March 28 treatments. So it has been, kind of like they were there for me. Now I'm there for them. And I know all of the questions to ask. And I know if I don't know the answer to it, I will find it for you. Like I have enough resources now that, if you need something and I don't know what the answer is, I'll call 5 people and then I'll get back to you and say, okay, well, this is what you should do. You know, I went with my dad the first time he went for his radiation and I met his doctor and he, as per normal doctor's offices, sometimes they run behind. He's not a patient man. He's not a patient man. And I knew he was nervous. I was nervous. I'm still nervous when I go every 6 months and to any doctor. And I said, this is, let me go find out. And I said, on Mondays, you're going to see the doctor after. Every Monday, you're going to see the doctor after you have your radiation. And he said, okay. So we went in and he kept saying to me, don't you have to go back to work? Don't you have to go to work? Don't you want to go to work? There wasn't anywhere that I'd rather be than with
Right.
him. And the same with my mom. Her husband went with her,
Mhm.
but I met them there. Like, she's my mom.
Mhm.
There's nowhere I would rather be than with them. There's just I would say you need to ask the questions. You need to be your own advocate always. You don't let anyone push you around if it's not driving with you, if
Mhm.
it doesn't feel good, then question it. That's what I would say.
I mean, that's really
But
to
go
remind
ahead.
people to do that, and it feels like you definitely did that. But it bothers me that a doctor would ever say that you're asking too many questions, obviously. Because there's never enough answers when you're facing the unknown, and we want all the education. Actually, I'm like you. I want to know all the knowledge and all the information. My trade is I'm a dental hygienist, so my schooling is the same as a nurse, and so I love education and knowledge and the body and science and like how things work. So when I got diagnosed, I was like, "Tell me all the things. What's happening? What can I expect? What should I expect for this surgery?" Like I wanted to know all the things too, and I got zero education, like zero. So when I did all my own research first of all, but then I went to one of my follow up with my surgeons and I asked his nurse, I was like, okay, so when I'm asking questions and I'm not getting answers, like what's up with that? Like what's up with like everybody skirting around the truth and not really saying it, but kind of saying it. And like you kind of have to fill in the blanks. And she was like, some people just can't handle the truth. But I was
Well,
like,
and
but
my
that's a
dad
lame
was like
excuse
that too.
though. I'm like, but then there's people like me who need the truth. I need all the truth.
I said that to my dad. I said, what stage is it? Did they tell you? Well, there's no stage, he said. I said, yes, there is. Yes, there is. No, there's no
Yeah.
stage. I said, Dad, yes, there is. So on his next visit, he said to the nurse, my daughter wants to know, blah, 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 blah. And she looked at the chart and she said, stage 2. And I said, I told you.
It's always
I said,
staged and
I
grades,
said, I told
types.
you. I said,
Yeah.
and the thing is, like, you just don't know what questions to ask.
Yeah.
And that's the thing. It's like when he introduced me to his doctor that first day,
Mhm.
he said to him, I brought my own personal cancer doctor with me. I've never been to medical school and I don't ever plan on going, but man, let me tell you, some of the things I've seen over the last 10 and
Yeah.
a half years, you know,
It does make you feel like an expert of sorts. I mean,
it
you
does.
know a lot.
It does. And I was very um fortunate to take part in, at least here, we had a lot of like free resources.
Mhm.
So there was a gym here that offered like a 12-week program for cancer survivors. So I went in the summer of 2015 and I started like, jogging again. And I started like, I was like very careful about the things that I did, but at least you were moving. And there was all of these, they had like, used to be called cleaning for a reason, I think.
Mhm. I've
It
heard
was
of it.
like, and so they had free housekeeping. So they would come to our house while I was in active chemo and clean, and it wouldn't cost us anything. I mean, so I took advantage of a lot of like resources like that were in and around our community. And I tell people that all the time. I'm like, if you have them in your community, I'm like, please, like, take advantage of them. But I would say, well, it was actually around now, 10 years ago, I was not feeling good.
Mhm.
Um, and I had started jogging at this exercise thing. And I said to the oncologist, like, I don't know, my right side, it just like hurts. Like, it doesn't feel good. And she said, oh, it's because now you're exercising. And I said, no, it's not like a pulled muscle. Like, it's, it's something else. And she said, well, when you come back in 3 months, if it's still not feeling good, then I'll scan you. And I said, okay. And so we left, and I just had not felt good.
Mhm.
And it's like, you know yourself, like, you know your own body. So when we went back, I said to her, like, I'm still exercising and not killing myself. I wasn't like overexerting myself because I still was still in treatment and was, down the line here. And I said, my right side hurts. Okay, she said, we'll scan you. So she did. And then, I don't know, a day or two later, she called me at home.
Mhm.
And it's like, some of the things you don't forget even when you have chemo brain. It's like I remember sitting at my desk where I was on the third floor, what time of day it was. And she said, Hi, Joslyn, it's Dr. Evangelist calling. I said, Yeah, this can't be good. You're calling me at home at night after work.
Mm.
And she was like, Yeah. She said, How are you feeling? I said, Well, I'm all right. But I guess you're about to tell me how I'm feeling.
Yeah.
And she said, I had a cyst on my right ovary.
Mm.
It was about the size of a grapefruit,
Oh,
which
wow.
was what was causing the pain from
Right.
jogging, was
That's a
not a
big
pulled
cyst.
muscle.
Yeah.
And she said, your appendix is 10 times the normal size.
Oh my gosh.
So she said, that's going to have to come out. And I said, okay. So again, my mom and I went to the doctors, and here we have two like large health systems. And we went to the first doctor, and he said to us on a Friday, he looked at the imaging,
Mhm.
and he said, I'm pretty sure, I'm like 90% positive it's cancer. You have appendix cancer. And I
What?
thought, that's what I said. And he said, whoever's office and table you can get on first so you can get this out, like, you need to do it. And I thought, okay,
Mhm.
wow, okay. That was on a Friday. Monday, I had an appointment to see my gynecological oncologist for the cyst on the ovary. And he said, Yeah, your ovaries and tubes are going to have to come out. And I said, Okay. So he said, I have an opening tomorrow. Now, he had privileges at this other hospital, and that other hospital is where I saw the guy from Friday.
Yeah.
So neither one of them knew each other. And he said to me, You're going to go home tonight. You're going to do a half a colon prep, and I'll see you tomorrow morning. And I said, What? I'm going to my mom's for dinner tonight. And he said, Nope, you're not eating dinner tonight. And I was like so sad because it was like right around St. Patrick's Day. So she was having like corned beef and the whole fixings. I was so sad. Everyone else was going to have it, but me. I was having like Miralax or whatever it was. Um, yeah. So he called this other surgeon who he didn't know him.
Mhm.
And he said, I understand you saw a patient of mine on Friday. I need to take her ovaries and tubes out. I need you to take her appendix out. So he cleared his schedule the next day, this other guy that I saw on Friday, and they were both in the operating room. So I always say, like, two surgeons walk into an OR. It's like a joke that I do because they each had their own teams of
Yeah.
people. So that day I had 3 organs out. I mean, it was brutal.
Yeah.
Outpatient. Actually, I think I did stay overnight one night, but they put me on the maternity ward,
Mm.
which is, if you're a breast cancer patient and you just had your ovaries and tubes out and you're not a parent yet,
Right.
it's not like the best spot to put you.
No.
But I get it. So yeah, so that happened. So that was like the second half. I call it like part two.
Yeah.
And
Was it
then was it what?
was it cancer in the appendix?
No cancer.
Okay.
Knock on wood, no ovaries and tubes. They didn't have cancer either, thank God.
Okay.
But like, so the next week I was like up and walking, and I was like, working part time remotely
Mhm.
on my non-weeks of chemo. And I remember like being in the grocery store with my mom, and I was pushing the cart. I said to her, "Oh, I have like a pain in my side. I don't know. I need to sit down." So when I sat down, the pain went away,
Hmm.
and I was like, "This is so weird." So then we got home, and I started timing it on my phone because it kept happening.
Mhm.
It was happening more and more and more. And it's like the more I was upright, the more pain I was in. But if I sat down, the pain would go away. I thought this is like the most bizarre thing ever. So I was in the shower, and we were trying to go to Ash Wednesday Mass because it was around Easter time. And I was like trying to, bathe myself. And I couldn't get out of the shower. So my boyfriend had to help me get out of the shower, help me towel off. And he called my stepmother, who's a nurse, and he was like, She's in so much pain. Like, I don't know what to do. And she said, you're gonna have to call like the doctor's office and see like what's happening. So they told us to go to the emergency room, which I did. And you know what that's like. You're there for like a minute.
Yeah.
You like gotta
One
pack a
thousand
lunch.
million dollars.
Yes, you gotta like pack a lunch. And they scanned me, and someone had left a metal clip inside of me. I can't
Stop
make
it.
this stuff up, Tara. I can't make it up.
Oh
Can't
my
make it
goodness.
up. So then it was like, did Dr. A do it or did Dr. B do it? And because
Right.
I was in the hospital of Dr. A, like B's people wouldn't talk to A's people. And I thought, can someone just fix me so I can feel
Right.
better?
Yeah.
Because it felt like this metal clip was literally like ripping my insides,
Yeah.
which is, and
Puncturing your organs.
the
Yeah.
more I was upright and moving, the more ripping I could feel. But when
Good
I sat
grief.
down, it didn't hurt.
That is the craziest thing.
So then there was that. So it's like, yeah, I'm like telling
Been
you,
through it.
I have been through it. Yes, I have been through it.
But you still keep such a good positive attitude through it all. That's a lot to kind of experience, but I mean, you're still here, you're still thriving. How long has it been since your initial diagnosis?
It'll be 11 years in July.
That feels good, right?
It does.
So I
It
want to touch
does.
on something because I know that you said that you had a double mastectomy with reconstruction, but you're still getting checked. So when you get checked after mastectomy, talk about that. Like, what does that look like? Do they do imaging?
So sometimes you're supposed to have a breast MRI.
Mhm.
I don't know what it's like in other states, but here in New York State, they don't like to give you breast MRIs. Like you have to really fight to get them.
Mhm.
I had one last March because I had fallen and I fell down like on my chest. So I had one to make sure the implants were not ruptured. In October, from what the plastic surgeon tells me, I was taking something apart here at home and I yanked up on some like a PVC pipe and broke the capsule around the implant.
Mm.
So since October, I have been uncomfortable, I will say. And I
Mhm.
just had my oncology visit last week and she said to me, "No, you need to go back and see the plastic surgeon because it may need to be replaced." I'm going to tell you, it's not easy. Those are not easy. I mean, I'm claustrophobic, A. B, I usually have to take 2 Ativan and a driver. So it's like it takes a whole day of like, oh, I have to take the day off from work and then I have to ask someone to take me. And then, even 2 Ativan sometimes don't work. So I would rather not have the imaging, but you're not having a mammogram anymore. So every 6 months. So like last week I saw the physician's assistant in the oncology office. Then I will see the breast surgeon, my new breast surgeon, because like I said, the one that I had retired. So I'll see the new doctor. She's usually like in the summer, and then I see the actual oncologist in October. So they kind of like stagger, they want the appointment staggered. I do have to see a dermatologist twice a year. I do see a gastroenterologist, and I have for many years, even before I had cancer, because colon cancer runs in our family. So I've been getting colonoscopy since the age of 30 also, which is,
Fun.
it's super fun. And then I also get a test called EUS, which is an endoscopic ultrasound. So it's basically the same prep as a colonoscopy. It's just done in a hospital setting because they can see further than a colonoscopy in like an ambulatory surgery setting. And there
Oh,
is a spot that they are watching. He's been watching it for years. But because I am BRCA2 positive, I am at higher risk for colon, pancreatic, skin cancer,
yeah.
like we're at higher risk. So there needs to be like additional monitoring.
Yeah. Well, it sounds like you have a good team on the monitoring side of things.
I do.
I think that it's worth knowing that you're at higher risk with BRCA2. It's worth knowing that you still have to get some sort of breast imaging. There was a misconception that I've heard, a rumor, I don't know what you want to call it, but that once you have a mastectomy, you don't have to get scans anymore. I've heard several survivors say that, and their doctors
Really
actually told them that once you've had a mastectomy, you can't get cancer, which is not
false,
true. It is not
false.
true. I've met face to face a woman who had a preventative mastectomy because she had the genetic BRCA1, and then she, in fact, got breast cancer stage 4. because there was just a little bit of tissue. So I just want to debunk that for those listening. Like, you still have to get some sort of imaging. So that's why I wanted to go a little deeper on that topic. And then another thing, I want to shout it from the rooftops how important it is for women who are of childbearing age to do like what you said. Thank God for that woman that was sent to talk to you that day in the lobby, and you connected the dots and were able to do, what you needed to do to have that option. So many women, especially at things like YSC, they're all so young in their 20s. And unfortunately, when you get the diagnosis, you're rushed, and you got to do, and you feel like you got to act now, but really you need to stop and just think. And we touched on it a little bit, oncologists are not the problem. It's not that they're not doing their job, it's that their job is to take care of the cancer. I say
Absolutely.
they see, this tiny problem. I'm up my whole body, but they have this problem that they're dealing with, and they are really good at taking care of that problem. And they're really good at like taking care of the cancer, but they're not thinking of like the side effects for the rest of your body, or like the long-term effects of, mastectomies and lumpectomies, and, taking the lymph nodes out. All these things create other problems, but their problem they've solved. So I think that's more of a thing, just knowing, you know, going to get exercise and why it's important, and knowing about physical therapy after surgery, and knowing about, what you did with preserving your eggs and all that for fertility. I think that's wonderful that you were able to do that. And I want so many women to understand that that's something that they need to be doing on their own as well. And what was the name of the organization that paid for it?
It's called Live Strong.
Okay.
Is like we have it here. I'm assuming it's nationwide, but it's based in like the Ys in like the YMCA's here. And so they run cancer programs. They run like cancer fitness programs. And that's how I had known them. I didn't realize that they, like, when you say Live Strong to me, the only thing that comes to mind is like Lance Armstrong.
Right. That's what I
And
thought.
so I was just like, what do you mean they're going to pay for it? Okay. And the lady was like, we're going to fill out all the paperwork and blah, blah, blah. And I was like, really? And she's like, here you go. Have all your stuff and bring it home. And
Yeah.
I said, okay.
Which is amazing though, because how many nonprofits are out there wanting to serve and help and do all these things for us, but we don't know they exist. So one cool thing that I took away from the YSC Summit was I not only was doing my booth, but I walked around and interviewed all the vendors that were there, and I learned so much. There are so many resources. But as a patient, nobody mentioned not a single one to me. So it was up to me
I know.
to find it and to look it up, kind of like how you found the ones that come clean your home. Like, I didn't find out about that till I started the channel, and I was like, that would have been a huge blessing, a
Yeah.
huge, huge blessing. There's so many different resources out there that we have not even tapped into.
I mean, I don't know if you've heard of it, but they were at this year's conference, Casting for Recovery.
Yes, I did. I talked to them.
So I went on one of their retreats like right after COVID, and it was life changing. I mean, my dad took me fishing when I was 5. I think I caught one fish at camp and screamed all the way at the other end of the lake. My grandma could hear me, she said, because like it was wiggling in our rowboat. But like what they do for you, it's not just like the physical, it's the mental, it's the emotional, it's everything in like, 2.5 days. And the women that I met there, ironically, 5 of them were from the capital region where I live. And I had no idea out of the 12 or 14 women that 5 of them were from here. And, like we've stayed friends. And I also found out about this other one. It was called Paint the Delaware Pink. So almost 2 years ago, I went on that fly fishing trip, and it was awesome.
Yeah.
It's like a scaled down version of Casting for Recovery. It's like, a woman who started her own organization. She doesn't have maybe like the resources that Casting for Recovery has, but it was small and intimate. There was only like 5 or 6 of us there. We were all paired up with an angler, and again, it's like the mind, the body, everything. Like, and it was such a great weekend. And she brought a gentleman, 2 guys actually, that cook for Facebook, like in New York City. And they donated their time. They came there. They cooked the most delicious food I've ever had in my whole, like things that I would have never tried, but like basic things like grilling pineapple. I mean, just the creativity that like these chefs like put into like making us lunch and dinner for 3 days was just like unbelievable.
Well,
Yeah. I mean, we have another thing which I'm going to try to get into this year. It's called Camp Bravehearts. I mean, but it's open to everyone. I've never ever taken advantage of it. I used to sit on the board of Joyous Foundation. That's a local organization here that provides free outdoor activities for cancer patients and their families.
mm,
And I can't say enough wonderful things about it. You know, there's camping, there's boat trips, there's tubing, there's
mm,
summer activities, there's stuff just for kids, there's rock climbing, there's every single thing. So there's a lot of things that, you know, patients can take advantage of regardless of where in the US you live.
yeah, 100%. There are so many organizations that are nationwide, global, whatever, but they are wanting to help. And so these are all great organizations, and it is such a blessing to be able to be a part of it and have that connection, that community. And it is so important to make time for ourselves. I think as women, so often we don't, and we put everybody first, and we're always willing to do for others, but we don't always do for ourselves. And so sometimes taking that time to take that trip and to make that connection and to be open and vulnerable, it can change your life.
I will say I did lose two good friends on my cancer journey,
Mhm.
and that was hard.
Yeah.
You know, because you don't ever think like, you know, after 20 or 25 years, someone's gonna like give up on you.
Yeah.
I mean, one woman I knew since high school and just literally poof. And the other woman I had known for, you know, maybe 5 years, but she was also a friend and, you know, I loved hanging out with her and we loved like going places and doing things and it's just like, well,
Yeah.
I do some people come into your life for a reason, a season, or a lifetime. And I think that, you know, some of those people cycled out, but the amount of people that I've met over the years, I mean, my first YSC conference was in 2016, I think, or 2015. I went to Texas first, then I went to Atlanta. So I think Atlanta was in 2016. Like, I've been going to these things for 10 years and, you know, I needed a ride from the airport and I called my friend and I said, "Are you going to the conference?" And she's like, "Yeah, do you want me to pick you up at the airport?" I said, "Yeah, so I don't have to, you know, get an Uber." And it's like, you know, we've been through like deaths and babies and marriages and all sorts of things with one another. And it's like the friendships and connections that you make last a lifetime.
Mhm.
And I'm so grateful for that.
That's beautiful. And I think that a lot of people don't know how to really handle the weight of someone having a cancer diagnosis. And it's not really anything other than they're not there for you for that season, you know? And then I think other people come in at just the right time to help you through. So that was hard for me too. I lost a lot of friends that I had known my whole life. And the ones that I thought were going to show up and help me through didn't. And then people I didn't hardly know at all stepped in like they had known me their whole life. And it was that part was hard. But like you said, like the connections I've made now from breast cancer, those connections are deeper and more meaningful, and the friendships are, stronger. I guess maybe we have a more of an understanding of how life is short and precious, and to love while we're here, and to live while we're here, and to do all these things while we're here. So, well, any advice that you would have to share with someone who just got diagnosed, anything that you would tell them to get them better prepared for their journey?
So many things. I would say ask a lot of questions, always. Write it all down because you'll forget. Bring someone with you to an appointment so there can be an extra set of ears. And then just allow yourself grace. You know, I am stubborn and I don't like to take help from anybody. And there were so many people willing to help us and to help me, like with rides or with meals. People set up a meal train and they brought us food, you know, the weeks of chemo. And, you know, the oncology office foundation gave us gift cards so we could buy food. And one thing I did not tell you was I did lose my job. I got fired when I was going through chemo. So I was unemployed. So it was like my parents sustained my personal bills. My boyfriend sustained our house bills, but then anything extra that I used to pay for, like groceries or movies or vacations or whatever, like we didn't get to do any of those things because I didn't have the money because I had lost my job. And so, um, it's like people rally around you and, people, he would come home from work because he was an executive chef and he would have a tub full of food. And I'd be like, did you steal that food? And he'd be like, no, my boss gave it to me. I'm like, are you sure? Like our family would, give us $100 here and there, or they take up a collection, or, just people would just leave stuff on our doorsteps and not even, they would know that I'd be resting or whatever, and they would just leave stuff and just text and say like it's outside on your porch, like.
Yeah.
So people are very generous. They are. I will say one of the hardest things that I had to do was walk through the doors of Hope Club as an actual cancer patient and not as a fundraiser or an event planner or a volunteer, because I had been going through those doors all the time for 15, 20 years. And the first time I went in there as a patient, it was like very different.
Yeah.
And so, like I still give back. We do like an annual barbecue in May for Memorial Day for all the cancer patients. I refer people to go there. I was very lucky and went to two support groups, one there at Hope Club and one at an organization that we have here locally called Two Life. And Two Life is just for breast cancer survivors. And they have a boutique and, like they have wig fittings and, that was that first support group that I went to when someone told me about it. They were like, "Oh, you should go." And I couldn't drive yet. And my dad said, "I will take you." And I said, "Well, what are you going to do for an hour while I'm at this?" And he goes, "Don't worry about me." He said, "I'll just take you and drop you off and then I'll come back and pick you up." And I said, "Okay." And it was, I don't know, 20 minutes, a half an hour from here. Not that far. And I remember getting in the car and just being like da 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 da. And to this day, I'll never forget when he said to me, "I knew you found your people because you wouldn't shut up in the car." He was like, "You were so excited, like it was your first day of school, and like you met your people." And it's like people don't really get that unless you're in it. And I was like, you know what? I think you're right. But I didn't get it then because it was like my first meeting and I just was like so excited to like meet other women they were at all different ages and at all different stages. But it was just nice to hear like, "Oh, you have the same side effects as me," or, "Oh, you lost your hair at this time," or, "Oh, what are you doing for nausea?" And it was like we compared war stories
Yeah.
basically. And it was like I found my people. And I'm so grateful for that. I mean, if cancer gave me anything, I will say, like, it gives you this community. And that's what I'm very grateful for.
Yeah, me too. I get to meet awesome people like you.
Well, thank you.
It's true though. It is so true. That's a great way to sum it all up. It brings you your people. It does. And it makes you better people. And I bet you now that you have had cancer, you can sympathize and love on the when you're volunteering on the patients even more so in a different, deeper level than before. Before it was just out of love, but now it's out of love and understanding, and that's different.
Well, I met a woman when we were in Atlanta at a booth. I mean, I met her. She was from Washington State. And we were kind of like palling around, and we got to the booth that had the compression sleeves.
Hmm.
And I said to her, "Oh, I wear these. Like, you're supposed to wear them. I wear them to fly. I wear them to exercise. I do spin class." And she was like, "I don't know what you're talking about." And the two ladies at the booth were like, "You just had your mastectomy. Like, why aren't you wearing them?" And it's like nobody told her.
Nobody told her, yeah.
And that's the thing. It's like, I just want to educate people
Mhm.
about, like, you talked about physical therapy earlier. And I remember going back to the plastic surgeon's office and I had like no range of motion. And she said to me, "Well, why aren't you going to physical therapy?" And I said, "Well, you didn't tell me to go there."
Mhm.
And she was like, immediately, she ripped off the script and she was like, "Here, you need to go to physical therapy because you need to get your range of motion back." And
Mhm.
I thought, okay, well, this would have been good like 4 weeks ago when I first was
Right.
here. Like, why are you just telling me this now? And then I went to physical therapy and it's like nobody tells you Like, you have to be your own advocate.
You do on every single step of the way. So I'm glad you touched on that because truly you can end up with scar tissue. You can end up with disability from the scar tissue, limited range of motion. It can really limit your life. And people don't understand that you have had an amputation. It is a major surgery and everything is connected. And if you're not moving and keeping that healthy, and you can really, really, really end up in a bad situation. And then lymphedema, of course, there's not enough education out there about that and how common it is when they just even take one lymph node. They're messing with your lymph system. So understanding and knowing what that is and knowing that everything's connected and all these things. So that's the heartbeat of my channel. That's why one of the many reasons why I'm wanting to highlight stories like yours because you touch on these subjects and it is so true because the more we say it, the more other people won't have to suffer as much, I think. They'll go into their battle a little more prepared because you've been honest about what you faced. And you can give them a little hope knowing that they're going to come out of it on the other side. So, well, let's wrap this up. I'm so thrilled that we finally got the technology side to work. I knew it was going to be a great story. And it certainly has not disappointed. You've been through it, but man, you still seem so positive and happy and, thankful that you're on the other side. You have given yourself lots of grace and your medical team. And so thank you for taking the time to share your story with us.
Thank you for inviting me, and thank you for always exuberating. You exuberate. I can't even talk now. It's too late. Like, you radiate sunshine and smiles, and I
Oh,
love that. So thank you.
well, it's a joy, to be alive. So let's just keep on spreading it. All right. Well, thank you, Jocelyn. You guys, thanks for watching. Stay tuned for another episode. And if you have any questions, just feel free to reach out and we can connect you. All right. Till next time. Take care.